Well, Ontario has announced that it will extend stay-at-home orders for Toronto, Peel, and North Bay Parry Sound.
I've been unwavering when it comes to supporting our local health officials.
Premier Doug Ford's government says the lockdown measures in those regions will remain until March the 8th at the earliest. It comes as variant cases are on the rise, but some restrictions will be eased in York Region next week. York will rejoin the province's color-coded reopening framework on Monday. So Dr. Stephen Flindall is an emergency room doctor in York Region, and he joins us now from Aurora. Doctor, thanks for your time. Really appreciate it like this early on the weekend.
Oh, you're welcome. Good morning.
Good morning. Let's talk about your reaction to York Region. And of course, for people outside the Greater Toronto Area, York Region essentially one main road across from some other parts of the area that will remain under lockdown. What's your reaction to them easing restrictions?
I'm disappointed and concerned by that decision.
Why?
Well, as you say, it's a street that is a border. There's no physical barrier. People are able to cross that quite easily. And we saw during the lead up to the Christmas lockdown, where Toronto was ahead of us, that people were coming up to York Region in droves to shop. And I don't think there's anything preventing a recurrence of that behavior. And then on top of that, we've got these variants of concern that are much more transmissible, becoming more common in the population. And in the case of a condominium in Mississauga, just casual contact has been enough to cause transmission versus the usual 15 minutes of close contact that you'd see with the standard COVID.
You're a medical professional, but you're also in this context emergency room doctor. So if we talk about the B117 in particular, first identified in the UK, and what appears to be a rapid spread, what are your concerns? How are you afraid this is going to wash up on your shores in the ER?
Well, the vaccine rollout has been agonizingly slow, as everybody is aware. And even though we've got good penetration of the vaccine in long-term care facilities, there are still many, many people living at home who are elderly with chronic disease that if they get this virus, they're going to be hit pretty hard. And almost none of them have had the vaccine yet. And I've already started to see a bit of a shift away from sick people with COVID coming from long-term care to elderly people living at home coming in quite ill with this.
So is there any way you think the region could safely reopen?
I, like many people, believe the highest priority is getting kids back into school. Just this past week, York has reintroduced in-person learning. And it was a short week to begin with Family Day, and then there was a major snowstorm. So they've only been back in school for 3 days. I think you need to open in stages, and you need to take time in between reopening anything. And with schools being reopened, I think it would be wise to take an incubation period, be that between the 10 and 14 days, to see what the impact of school reopening is before you loosen restrictions elsewhere. Otherwise, you're not going to know where this is coming from when the numbers start to increase.
Now, we've seen many medical officers of health from across the country warn about their concerns around the variant and around reopening too soon. The York Regional Medical Officer of Health, Dr. Kurji, he supports the reopening. In fact, as we understand it, he was pushing for his region to be pushed into that red zone. What would your message be to him?
I would say exercise caution. Every official in the region has, not in our region, in the bordering regions is asked to stay in lockdown. Dr. Tam, the Chief Medical Officer for Canada, has warned about reopening and loosening restrictions. And when you compare the metrics for York Region to Toronto and Peel, who have asked to stay in lockdown, our metrics are, except for 1 out of 18, worse than those regions that have asked to stay in lockdown. So I just don't understand his eagerness to loosen restrictions at the moment.
As you say, at the moment. So that seems to be key in all of this. In terms of the timing, we are still fully in the middle of winter. Let's talk about in the coming weeks. Ideally, what would you like to see happen in your region?
As I say, I'd like to see schools establish their reopening and see if there's any impact with case numbers with schools opening. And then you can talk about loosening restrictions on non-essential businesses and then monitor the impact of those changes. I don't think you can just open multiple segments of the community simultaneously and expect there not to be a rise. And then when there is a rise, what are you going to do? You have to shut everything down that you've just reopened. And students are almost in crisis mode now, and everybody recognizes that. And my fervent wish is that at the very least, we can maintain in-class learning for those students.
Just got about 30 seconds left, but we have heard, of course, Dr. Theresa Tam talk about that even if the current restrictions stay in place, we could see 10,000 cases, which is essentially triple what we're experiencing right now across the country. Mm-hmm. What's your worst case scenario?
Well, my worst case scenario is that we open too quickly and the line we would be on is much worse than 10,000 a day. They said up to 20,000 a day. And if people have thought things are rough to this point, that is going to be much, much worse than anything we've seen so far. That would be overwhelming to the healthcare system.
Dr. Flindall, I want to thank you for your time. I really appreciate it.
Thank you.
Dr. Stephen Flindall is an emergency room doctor, New York region, and he joined us from Aurora, Ontario.